Antenatal depression is depression that's occurring after a mother has become pregnant or found out that she's pregnant. Depression occurring at any time involves feeling very low in mood, but as well it can involve a number of other problems, such as feeling quite anxious. Mothers with antenatal depression will often report that they really are very worried about the baby that they're carrying, even though people are trying to reassure them that things are okay. They might have lots of anxieties that are really out of proportion. They might find it difficult to sleep, find that they lose appetite, their concentration is bad, find at times that they're very tearful. And at its very worst, mothers can sometimes think that they feel so low in mood that they wish they just didn't wake up the next morning to be free of the feelings. So it can be quite a severe illness. Pregnancy, of course, or finding out you're pregnant, finding out even for a father that you're going to be a parent, is going to bring a lot of changes and a lot of adjustment in your life. And mums are going to have a big responsibility. They've got to ensure that they carry the new baby all the way through to the time of delivery safely. They've got to look after themselves. They have a lot of hospital appointments. They have to explain to other people that they're a new mum, and for some people that can be a shock if they find out that they're pregnant out of the blue. It might be unexpected, and even for people who are trying for a new baby, suddenly it becomes very real that they have a lot of changes to make in their lives. And so people go through a lot of ups and downs, even though, as I say, we might expect it to be a happy time. The parents of the baby sometimes have to sort of renegotiate their relationship. They go from being boyfriend, girlfriend, husband and wife to now to being parents and everything that entails. So there are a lot of stresses and strains which probably give people, as I say, those good and bad days, but it's when women feel low and that low mood goes on day after day that we call it depression rather than normal sadness. It's thought to affect probably about 1 in 10 women, which is the same proportion of women who would have depression even when they're not pregnant. Depression is surprisingly common. But of course it's a big worry because the mum is now carrying a new baby. And of course if someone has antenatal depression and it's not treated, then it may well persist during delivery and it'll of course turn into postnatal depression. Depression isn't automatically cured by having a baby. The important thing is to enable people to talk about how they're feeling, because on the part of the mother, it's helping her to recognise that this low mood is out of proportion and that help is available. But if a doctor or a midwife or a health visitor meets someone with depression, it's, as I say, it's allowing them to talk, and particularly in a non-judgmental way. Women are often quite fearful about talking about how they're feeling. They worry that perhaps they're going mad, as people sometimes say to me, or that people will judge them in some way, or that they're a bad mother. So it's important to allow people to talk, and there is help available, either through talking therapies such as counselling, or sometimes for severe depression, antidepressant medication.